Welcome to the educational lesson, Understanding Depression in Later Life. My name is Sean Brotherson, Extension Family Life Specialist with the NDSU Extension Service, and I will be sharing some information today about the topic of understanding depression as individuals grow older. I am also joined on this topic by Jane Stroman, Extension Aging Specialist with the NDSU Extension Service. Thank you for your interest in this topic and how it might be of relevance in your life and work. There are a number of key issues that we would like you to become familiar with as you follow the lesson outlined today. Key objectives for this lesson include, first, to understand key issues relating to depression, anxiety, and suicide in later life, to learn about signs of depression and related mental health concerns that can occur in later life, to explore specific strategies for managing depression or related concerns in later life, to gain knowledge of specific resources to deal with depression and related concerns, and finally to educate the community about mental health issues that can occur in later life. I'd like to begin our discussion on the topic of depression in later life by exploring a few statements related to the topic of depression and whether they are true or false. Please think about the statement as it is asked and whether you perceive it to be true or false. The first statement is, depression only develops when someone has had a major traumatic experience in life, such as the death of a spouse, a heart attack, or other major health concern. Do you consider this to be true or false? The answer to this statement is false. It is a myth that depression occurs only when people experience major trauma in life. Perhaps think about some of the factors that might contribute to the experience of depression in later life. The reality is that depression is a commonly occurring mental health condition that can arise in a person's life due to a variety of factors, including genetic influences, body changes, stresses in life, personal losses, or other factors and influences. Let's consider the next statement on the topic of depression in later life and whether it's a myth or a reality. Again, please think about the statement as it is made and whether you perceive it to be true or false. The statement is, individuals dealing with depression usually can overcome it if they just work to cheer themselves up or pull themselves up by their bootstraps. Do you consider this statement to be true or false? Again, the answer to this particular statement is false. It is a myth that depression can typically be overcome simply by telling yourself to feel better or pulling yourself up on your own. The reality is that depression is a complex medical and mental health condition that typically does improve with a variety of approaches, which may include therapeutic support, social support from friends and relatives, exercise, a healthy diet, rest, and medication as prescribed under the direction of a physician. Here is a final statement that we'd like you to consider and whether you perceive it to be true or false. The statement is as follows. Seeking assistance from a doctor or mental health professional for depression is a sign of an inability to handle your problems or a personal weakness. Do you consider this statement to be true or false? The answer to this statement is false. It's also a myth that is sometimes commonly perceived that individuals dealing with depression are emotionally weak or unstable, or that seeking help is a sign of weakness. The reality is that depression is a condition that anyone can experience. Seeking assistance from competent professionals often is necessary, and it signals wisdom, understanding, and strength on the part of the individual who is seeking assistance. Depression is an important condition to understand because it affects a significant number of people and it can have severe consequences. For example, it may disturb a person's thoughts and feelings, alter a person's behavior, and cause physical difficulty and emotional distress. However, depression can be treated effectively when diagnosed and managed with care. It's everyone's responsibility to understand depression and help individuals find effective solutions.
There are many factors that may raise the risk of depression for aging community members, such as living alone, having no relatives or friends nearby, or experiencing recent losses. Being aware of these risk factors can enable greater awareness of this condition. So, what is depression? Depression is a mental health condition characterized by an inability to concentrate, insomnia, loss of appetite, physical tiredness or fatigue, feelings of extreme sadness, guilt, hopelessness, and helplessness, and thoughts of despair, discouragement, and death. It's also called clinical depression. Almost 4% of people aged 55 and over living independently in the community suffer from major depression in any given year. Depression usually is marked by a variety of symptoms occurring together during a period of more than 2 weeks. Occasional episodes of fatigue, discouragement, or anxiety are common for all individuals. However, when a wider array of symptoms develops and lasts longer than 2 weeks, then clinical depression may occur. Some individuals may experience symptoms that are substantial risk factors for depression, such as social isolation, personal history including chronic medical illness or prior depressive episodes, and family history of mental health issues or alcohol abuse. It's important to assess a person's experiences to consider the risk for depression in his or her life.
Among older adults, challenges with anxiety often occur at the same time as depression. Research on this topic indicates that 26% of people with anxiety also experience depression. But in addition, about 48% of people with depression also experience anxiety. Thus, depression often is accompanied by anxiety as a kind of traveling partner when it occurs in older adults. Anxiety is a common mental health condition that often accompanies depression. The experience of anxiety is typically marked by intense mental worry or confusion that becomes debilitating. If a person experiences anxiety that is intense or frequently present, carrying out basic tasks or functioning in a social setting can become difficult. About 1 out of 10 individuals over the age of 55 undergoes the experience of dealing with an anxiety condition in any given year. So, what are some symptoms to be aware of? Symptoms of anxiety often include mental and physical signals. For example, the mental symptoms of anxiety can include a high sense of worry or fear, a feeling of being paralyzed, or a sense of panic. Anxiety is also often indicated by a variety of physical signs. First of all, this can include fatigue, disturbed sleep, or feeling jittery. Other physical signs in your muscles or head can include tight or sore muscles, feeling dizzy or lightheaded, or having an upset stomach. Some additional signs include a shortness of breath, increased heart rate, dry mouth, or sweating. If you or another person is experiencing anxiety, focus on strategies to calm down and feel more in control, such as getting to a familiar setting, sitting down and breathing regularly, or other strategies. As with depression, a variety of risk factors contribute to the possibility of experiencing anxiety. If a person has a personal history of previous encounters with depression or anxiety, a chronic illness, a history of substance abuse, or a tendency towards social isolation, these are personal factors that increase the likelihood of anxiety as an older adult. Other risk factors include a family history of alcohol abuse or family members who have experienced anxiety or mood difficulties. Women are more likely than men to deal with anxiety in their later years, and exposure to a traumatic event can also increase the risk of anxiety. An awareness of risk factors for anxiety can help individuals be more sensitive to what they or others might be experiencing.
Next, we're going to focus on grief, loss, and depression. Following is a short video from the National Institute on Aging that tells the story of an older woman who dealt with depression for years, but is now in recovery.
My symptoms included loss of appetite, inability to sleep. I guess for a while I was irritable. I would begin to shun people because I knew something was wrong and I didn't want them to know.
Peggy Templeman is 78 years old and has experienced depression throughout her adult life.
It would come and then it would go for maybe over 40 years.
About 2 million older adults in the United States suffer from full-blown depression. Another 5 million suffer from less severe forms of the illness. Depression in later life can be caused by a variety of factors.
The triggers for depression are changes in health, traumatic events, major changes in one's life circumstances, loss of people who are dear to you, loss of the ability to do the kinds of things that you are used to doing and give you pleasure.
The triggers for Peggy's bouts of depression included high levels of stress, an inner ear disease, and losing a valued psychotherapist.
And so I began to get sicker and sicker. My husband had to go to work. No one was at home. I was sick, and so I did not take the medication. And so finally, I did make an attempt to harm myself. I was seeking help.
Peggy did get help, and the combination of talk therapy and medications made a significant difference.
With the medication initially, and with talk therapy, psychotherapy, then I really began to get back on my feet. I had a marvelous psychotherapist who I continue to see periodically now.
Peggy's experience with depression involved a spiritual side, which she says was key to her improvement. She even wrote a book about it.
The medications, all of that, and the talk therapy led to the spirituality, the meditation, the sitting in silence, the communing with the Almighty.
Although depression is treatable, people should realize that it may take time to find the right treatments and for those treatments to work.
Treatments for it typically need to be approached as something that's going to take a considerable period of time in order to have a beneficial effect.
Peggy's journey out of depression was long and difficult, but she is now in recovery. And she has a message for those who may be